our first question. Our tech team will go ahead and invite you to unmute. It's Sin. Sin, if you go ahead now. Thank you.
Hello, Dr. Esselstyn. Thank you so much. I really enjoyed your lecture so much. Can you please tell me what blood tests and supplements are needed with the dose and frequency when following a whole food plant-based diet?
I guess I'm a little bit old-fashioned in that the literature that I read as recently as this last several months, it's very, very problematic to start loading up on supplements when if you are eating all the vital nutrients in a whole food plant-based nutrition, you're going to get your vitamins and nutrients from food, although I do suggest that our patients get B12.
Thanks, Dr. Esselstyn. And up next, we have Margie. Margie, if you can go ahead with your question by unmuting.
Hi, Dr. Esselstyn. Thank you so much for taking my call. I'm on a no oil, whole food, plant-based diet. I have done your protocol for the nitric oxide 6 times a day. And according to my test strips, it is perfect. It works. However, my homocysteine is 14. Should I be concerned?
No, I think if you're eating and you're getting all the B12 and folic, you're doing what you can. And I'd be a little patient with the homocysteine because it's hard for me to know how anybody who is eating as carefully as you are and is not going to be injuring their endothelium and is getting plenty of nitric oxide, I'd be a little cautious about your homocysteine. I wouldn't worry too much, but keep an eye on it. Maybe check it a couple times a year.
Thanks, Doctor. Up next, we have Sophia. Sophia, what's your question for Dr. Esselstyn?
Yes, please. Besides being on a plant-based diet, what are your recommendations to help optimize heart function during menopause? Unfortunately, I'm allergic to soy, which could have helped me. So are there any natural hormonal supplements? And I think that can help. Thank you.
Yeah, you make an interesting point. It's interesting that if you carefully look at the nation of Japan, the Japanese hardly even have a word for hot flash. And it appears that when we're eating the Western diet and our estrogen and other things become quite high during most of our lifetime, then when you go through a menopause, a change of life, the descent of the amount of estrogen is so large and so precipitous that it seems to precipitate these hot flashes. I would simply try to stick with whole food plant-based nutrition, and sometimes there are you can talk with your gynecologist. There can be some modest types of estrogen that can ride you through this period. But I really think that sticking with whole food plant-based nutrition, especially in the decade or so before starting to have a change of life, would be benefit.
Thanks, Dr. Esselstyn. Up next, we have Yaron. Yaron, if you'd go ahead with your question.
Yes, so I would like to ask you, Doctor, what type of affordable test like CAT scan you would recommend in order to check if a person have a blocked arteries?
Yeah, you want to be safe about this. You can start off and you could either have a CT angiogram if there's a concern, because it's relatively safe. Because you're not going to have a catheter going up into your heart. They're just going to be injecting some contrast into a vein in your arm, and then they'll time it so that when they take the x-ray, the dye or the contrast will be going through the arteries to your heart, and they can get an idea of what's going on. But if you're without much in the way of symptoms, and you probably could avoid many of these studies just like if you're willing to stick with whole food plant-based nutrition. Yeah.
Thanks, Dr. Esselstyn. And up next, we have DF. DF, if you'd go ahead with your question.
Hi, Dr. Esselstyn. Thank you for everything you do for heart patients. I just wanted to clarify, maybe you can clarify for me. You said that eat a fistful of high nitrate veggies 6 times a day. I think you meant, I just want to understand that it's every time it's a fistful, not like one fistful spread throughout the day. Thank you.
A fistful may be a little much, maybe a half a fistful or something like that. But also, I don't know, I couldn't tell from your voice, of course, whether or not you said that you would have any cardiovascular issues. But if you don't have any heart disease, you're still going to get plenty of green leafy vegetables if you do this 2 or 3 times a day. But it's just for the patients that in my practice, once they have a diagnosis of a cardiovascular disease, and I know they are depleted in nitric oxide, then I ask them to go to the 6 times a day.
Thanks, doctor. Up next, we have NW. NW, if you'd go ahead.
Hi, doctor. My question is, when you speak of mouthwash destroying nitric oxide production, does that include if you used a hydrogen peroxide mouth rinse, or are you referring to only alcohol-based mouthwashes? And secondly, would tongue scraping from mouth hygiene, would that affect anything?
Yeah, those are all good questions. I'm not sure I can tell you the answer between I'm just a little bit wary about it. Because hydrogen peroxide is pretty strong in its own right. I mean, it's effective for what you're doing to help clean those bacteria. But I would be a little bit cautious. If you want to see, what you want to do is cradle and cuddle and be kind to those bacteria that are in your tongue that are going to be responsible for reducing the nitrate to a nitrite, which is also why I have some reservation about scraping your tongue.
Thanks, Dr. Esselstyn. And up next, we have, excuse me, Janet is up next for you. Hi, Janet, are you there? Oh, there we go.
Yes. Okay. Yes. Hi, Dr. Esselstyn. First of all, thank you so much for all your phenomenal work with heart patients. We love you and love your work, and thank you so much. I was just curious about the 6 greens a day. Rather than 6 greens a day, can one have 3 greens a day, double portions instead of 6 times a day?
Well, again, I have to reemphasize that the 6 a day is for patients who have a diagnosis of cardiovascular disease. And now, the reason that I've retreated from somebody who's saying, well, why don't I just have a big salad at night? No, remember, what I'm after here is I'm after restoration of your nitric oxide. So if you do this repeatedly at breakfast, mid-morning, lunchtime, mid-afternoon, dinner time, and evening, what you are doing is you are all day long, you are trying to expose yourself and saturating yourself with this magic molecule of nitric oxide that is so important.